Yeah, we were supposed to take a call over there last week. Now December 2nd.
He walked out. He walked out in the middle of doing our job. And the other guy was trying to pick up where he left off.
Yeah. So they were going to repay all that and inside the always that came through 2 weeks ago.
Hey, good morning, everybody. It is great to be with you on this Friday morning, November 8th, 2024. We'll call our meeting to order. Appreciate your attendance and interest. I would ask you to join me in the Pledge of Allegiance.
Let us pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
With that said, Ms. Hamilton, would you do us a favor and call the roll, please?
Mr. Hostetler?
Present.
Mr. Jones?
Here.
Mr. Wallace?
Here.
Mr. Corman?
Present.
Mr. Ellison?
Here.
Mr. Pratt?
Here.
Mr. Livingston? Mr. Culbertson?
Here.
Judge Covington?
Present. With that said, then, we have a quorum and we can move forward with our agenda. First item of consideration are the minutes from 10:24 and 11:6. Those minutes were shared with you by Ms. Hamilton. Any questions or comments related to those as presented?
Motion sorry.
I believe we can approve them both together.
Sorry about that.
Was that another
That's my
comment? We got a motion and we got a second from Mr. Jones. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. We will move next. There are no transfers, so we will move 6 to bills and hand checks. We have a general to road fund, $250,000. General to capital fund, $50,000. Any questions or comments about the bills and hand checks as presented?
Motion for approval.
Motion. Second from Mr. Pratt. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Now, let the record reflect that Sheriff Jeremy Nettles submitted fees in the amount of $46,287.89, and County Clerk Rebecca Johnson submitted fees in the amount of $146,289.67. We will then move to a presentation from Candace Whitehouse with the Office of Affordable Housing and Homelessness Prevention.
What a title.
Yes, that's a mouthful.
It's so fun.
Sure. Thank you.
Candace, thanks for being with us.
Yeah. Well, I am passing around a report. I won't go through all of it line by line, but just some highlights. The housing needs assessment is coming to a close. Our consultants feel confident that we will be able to wrap it up by the end of the year. So we've finished with all the data analysis. We've closed both of the surveys. And so they're doing some report writing and recommendation writing, and I hope to bring that to you by the end of the year. If you recall the timeline, which you may or may not, when we first looked at this, there were, let me see, I think 9 tasks. Yes, and we're on task 7, so we are towards the end of that. The things we've done in the past couple of months are the employer survey, which I think I spoke with you all about. They had set a goal for us to collect between 50 and 70 surveys from employers here in Scott County, or employers who had business here in Scott County. We ended up collecting 117, so I feel like very proud of Scott County for our high response rate. And then we just closed the community survey, so that ran for about 3 weeks. Many of our partners helped us get that survey out there, so the Gathering Place, the Amen House, the Scott County Schools did a lot to help get that out there digitally, and then they went home in backpacks as well. The public library really helped us by putting bookmarks in books while people were checking out. Just lots of people stepping up to try to get that survey out there, so that way we got a high number, and we got a diverse group of voices coming into the survey. We didn't want just one, and so our consultant set us a goal of collecting around 1,000, and we officially collected 1,800. So I feel, again, really proud of Scott County for coming together and going above and beyond. And so the consultant will be taking that community survey and factoring it into our study as well. Another thing I wanted to highlight is that we just got word a week or so ago that we did, in fact, receive funding from the Kentucky Balance of State Emergency Solutions Grant. It's just shy of $100,000, and that will be going towards emergency shelter, so the low barrier shelter at the Gathering Place, and then it also is going to start funding our rapid rehousing program here in Scott County, which is something I know Joe Pat specifically has wanted for a long time. So yay!
Am I the only one that's going to clap? We're getting $100,000? I'm excited about that, and I appreciate it.
Thank you. Well, establishing the rapid rehousing program is a big thing, and that's opening a door for us, so hopefully that can just continue to grow with this grant. And then there's another grant that we can look into now that it's established to be able to open that program up. And again, quickly, it's a short to medium term rental assistance program for folks who are unhoused, and getting them into housing as quickly as possible. So that way they can get established in employment or medical care or whatever they're needing to be able to be stable. So that is great news. In partnership with that, we are looking to pursue CDBG funds to help construct the low barrier shelter, construct a new building. And so we've been told that getting that grant is another plus for us being able to pursue the CDBG fund. So we are going to start looking at that timeline. Karen, the grants administrator, is going to help me with that as well.
Grants.
Yes. And so we're needing more beds at that low barrier shelter because the need for emergency beds is rising. Heather Johnson does a great job of tracking that data, and the numbers are going up monthly, and so we need more space there. And then I also wanted to mention that while I specifically work, in Scott County, I like to keep up with what's going on around us, and I know Lexington just announced some more affordable housing units. So this is another win for our whole state. And so but I know that they have done a lot of work. Their offices of affordable housing and homelessness prevention were established over 10 years ago. So all the success that they're seeing now started, with creating those offices and started with the housing needs assessment. So I just feel encouraged that we're on the right track to be able to have announcements like that in years to come. I know that issues like that we feel passionate about are hard to be patient with, but it's hard to tackle affordable housing. In short term, it's a big problem that all communities are struggle with. If this solution was easy, then somebody would have come up with it by now. But I just want to be encouraged to let you all know we're starting this process by building a good foundation and being wise about our efforts. So if anybody has any questions, I'm happy to try to answer that.
Questions or comments?
Just briefly, the rapid and by the way, congratulations. I'm glad you all got that grant.
Yeah.
The rapid rehousing is going to help new renters get into properties. Like, that's what that's set up to be. Like, there's giving money to the landlords to.
Yeah,
Okay.
so it's similar to like a Section 8 setup. It's not Section 8, so I
Okay.
want to make sure that's clear. But it is, specifically to get the most vulnerable unhoused off of whether the street or in their cars and into rental units. And that funding can help mitigate some of maybe their like landlord history or poor credit, things like that. Some
It's
obstacles.
short term. It's basically short term, not long term. Yeah.
Would you term this as a bridge? That's what it is. And it'll be, that's,
Yes.
what I look at it as, a bridge to try to help people.
Situation where I guess somebody loses a job,
Yeah.
they get kicked out,
Yep.
cars for a while. type thing.
One of the biggest goals for KHC, Kentucky Housing Corporation, is to keep homeless as brief as, or prevent it as much as possible, but if it has to happen, keep it as brief as possible.
Gotcha.
So this is the grant that helps get them at that goal.
Other questions? Or Chad, do you have anything?
No, that's
else?
it. No, that's all.
Rick Hostetler and then Ryan.
So there's, and you've talked about this before, and like, as Chad said, and Judge, I was trying to write some of that stuff down while you were clapping. Sorry, I can't do two things at once. But with that said, so I'm working with folks that have used the net device. And so I'm meeting a lot of people in that world, and they got homelessness issues, transportation issues, and job issues, and that's typical, right, of that community. When they're homeless, there's a lot of extra, I don't know what to title it, but there's other things going on, they just seem to be getting deeper and deeper. With just as all positive way I can see it, but I guess it's kind of a comment and kind of a question. I'm finding out there are a lot of addiction recovery housing type things. There's different terms for that are in Scott County. Are you aware of that, or does that have a play? Because most of those people are homeless.
Are you referring to like sober living homes?
Yeah, that's a name. Some of them call it that, and there's some other terms. But yeah, sober living.
Yeah.
I mean, is that community part of this survey? Because there are a lot of folks, and I didn't know if you were aware of that, or I wasn't until the net device came along, and my wife and I volunteer and help alongside some of those folks. I just wondering if you were aware of that.
Sure, yeah. I'm very aware of the sober living homes to try to keep up with where they're at in Scott County.
Sure.
I think a lot of programs that are serving vulnerable people overlap. So to answer your question.
That's the term I was looking for, that overlap. I just wondering because they have this, obviously they're coming from the opioid use disorder, so they've got other issues, and that's what those recovery houses are doing.
Yeah.
They're trying to address that, but I'm finding out that most of those folks don't have their own housing. Most of them don't have transportation. A lot of them are looking for jobs.
Yeah.
So it's kind of the same overlap.
Yeah.
So-
There's some overlap. I mean, not everybody who's addicted to drugs is homeless.
No, that's true.
Yeah,
That's
but
true.
there is some overlap, and I think there's definitely always trying to encourage partnerships between programs. So
you are aware of it then, thanks.
yes.
So, before we go to Ryan, just want to acknowledge and let the record reflect that Mr. Magistrate Livingston has been on, had a little issue hopping on, but has been on since probably 9:05 or so, 9:10. Thank you. And then Ryan.
Yeah, my a little bit different, but do we have, I know it's not yet, it's November 8th and it doesn't feel like it, but eventually it's going to get cold. We're with the White Flag Shelter because I know we had one in the state. Well, where are we with that?
Yeah, so our partnership with the Gathering Place is still as it was, and they are still operating. I'm trying to transition calling it a low barrier shelter, so I know that maybe is tripping people up.
Oh, is that what the low barrier shelter
Yes.
is?
So the White Flag Shelter, when you all originally began, it was just temperature dependent. And so when it was below 32 or above 95, the Gathering Place has since decided that they are going to allow that space to be open year round. And by low barrier shelter, we mean that they are not entering the Gathering Place program. They are simply entering a place to get a roof over their heads. So there's no programming, no requirements involved. So White Flag, low barrier, we're talking about the same thing, but they are up and running, and Heather is ready for the cold weather. So,
But our agreement still, the trigger is temperature specific.
yes. So you all fund the nights that are temperature triggered. Yeah.
Okay. Good question. Thank you, bro. Thank you for bringing
Terminology.
that up.
Terminology.
Yeah.
Yeah.
Any other questions or comments?
Thank you all.
Very, very informative. Appreciate your time and your work.
Yeah. Thank you.
We will move now to Extension Board appointments. Allison Johnson shared an email with 4 names for consideration to serve on the Scott County Extension District Board: Chuck Tackett, James Happy, Kelly Brown, and Carol. And I don't want to butcher her name. Can you help me, Ms. Brewer?
It's Dubuquesky.
Thank you. I knew it. I was right. That was on the tip of my tongue.
It's good. It's good.
And you all had biographies shared of each individual. I do want to share that in the minutes from that meeting were shared as well. These are 3-year terms, and individuals can serve 2 3-year terms back to back. So bless you. So with that said, there's 4 names. What questions or comments would anyone have? You choose 2 of the 4.
Which ones would be reappointments?
I know Chuck Tackett is,
Yeah, Chuck and Carol will both be reappointments.
if reappointed.
I nominate Chuck.
So we have a nomination, we have a motion. Is there a second for Chuck Tackett?
Second.
We have a second. Any other questions or comments? All those in favor, please say aye. Aye. Any opposed? Motion passes.
I think one of the other gentlemen was Mr. Happy.
There's a James Happy, yes, sir.
Yeah. I'll nominate him.
So we have a motion there.
I'll second.
We have a second there. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Thank you all. With that said, then, we will move to Airport Board appointment. I shared by email a name of candidates, a packet of candidates that have applied, and I shared the name of Cameron Grossel, who has applied previously and is interested. I have talked with Mayor Jenkins. This is a joint appointment with the city, and Mayor Jenkins supports the potential appointment of Cameron Grossel as well. Any questions or comments about that?
Put him on the board.
So we have a motion from Kelly,
So
a second
the motion
from
needs to be to
appoint Cameron Grossel to the airport board.
finish out the term.
Oh, yes, and I shared that in the email. Thank you for bringing that up. So this is to complete the unexpired term of Martin Thomas and to be appointed to that term on January 1 for a
4 years.
for a 4-year term. And Mr. Grossel lives in Scott County and is a registered voter.
I like to know that.
So Judge, so at the first of the year, we won't have to vote again?
I would,
This vote would take
I
care
would
of it?
think
That's
so.
what I'm just clarifying.
Yeah.
and then just before we have any other discussion, there is another seat that will become open for a joint appointment on January 1. So in December, we'll have to reconsider another seat at the airport.
But that's a separate seat.
That's a separate
Yeah.
seat from this.
I just have and this is maybe for 4 years from now, but, so if he finishes out a term and then starts his term, can he be reappointed, or would that be his 2 terms?
No.
I don't think that would count as his
He's
2
eligible.
terms. So we had a motion.
I'll clarify my motion.
Okay,
Just-
thank you, Kelly.
Yeah, just to appoint Mr. Grossel to fulfill the remainder of Mark Thompson's term and to appoint him for a new 4-year term after that expires.
That's great.
Thank you. Second from Rick Hostetler. Any other question or comment? All those in favor, please say aye. Aye. Any opposed? Motion passes. We will now turn over to Jeff Mudrack and Cam Culbertson, County Attorney's Office new hire. And this position, with the election of a new Commonwealth Attorney, Kelly Kearney, congratulations to her and wish her nothing but the best in her endeavors. But this position is to fill that vacated position.
That's correct.
Cam?
That's right. You want to start or me? Sure, I'll start. Of course, on behalf of CAM, I'm just pleased to recommend the appointment of Erin Lopiano for the Assistant County Attorney position. Her salary, when looking at our pay scale for her position, would be $93,750. However, as you all know, when Kelly vacates her position, the county's portion of that compensation will be $40,710 because they also get some compensation, or part of the compensation from the state. So, and that'll be effective. That pay change will be effective as far as the county's contribution effective January the 6th. So, Erin, has a JD degree from Liberty University, and she's been working in the field with the Department of Public Advocacy since August of 2022. So, Kim, I don't know what else you'd like
No,
to...
that's yeah, pretty much covers it. We, had several applicants, or quite a few applicants, interviewed several. Really liked Erin. We brought her back for a second interview. Like Joe Pat said, we're excited to have Erin. We're also kind of bittersweet. We're excited for Kelly, but we're going to be sad to lose her at the same time. But she's going to, excited for her in her new role. So.
Cam, in how your all's order works, so will Ben kind of take over what Kelly did, and then will Vinny move up? I think that's his name, Vinny.
In the pecking order, I guess, if you want to say as far as seniority, it'd actually be Ashley Johnson.
Oh, okay, okay.
Been here longer, and then Vinny, and then this person. But we're all equals, right?
Yeah,
But Ben would become. Kelly is currently the first assistant county attorney, and then Ben will take over that role.
Yeah, but Vinny, I think, did child.
He's
support.
still going to do that.
Okay,
yeah.
I understand.
Yeah, that's a good question, and I specifically had that conversation with Vinny. His role is not going to change.
Gotcha.
He's going to keep doing that.
Okay. Motion for approval, Judge.
We have a motion. Second down there with Mr. Jones. Any other questions or comments? All those in favor, please say aye. Aye. Any opposed? Motion passes. And Jeff can stay up and present health insurance renewal. We have met, and you've talked to several magistrates about the options, and I'll let you take it from here.
Sure. And I think what is best, just for everybody's sake, is just, and for public consumption, is to recap what our numbers were for this current year, at least the estimate to finish out 2024. Hopefully everybody can see it. Maybe you can zoom in a little bit on the top section of that. There you go. That'll help some. If you look at the 2024 estimate column, the medical paid claims is $2,809,000. The RX claims are $693,000. That brings you a total claims of $3,798,000. Very positively, when you can back out the rebates we get from the pharmacy plan of $232,000, and the pricing guarantee payment of $30,000, and then some minimal stop-loss reimbursements for this year, that brings our net claims expense down to $3,510,000. However, then you also got to add back in the admin expenses that Anthem charges us for negotiating provider discounts and processing claims of $258,000. The stop loss premium is $418,000 through our current contract with Symetra. There's also an aggregate loss premium of $29,000. So your total plan expenses, claims plus admin, is $4,216,000. Any questions at this point?
And just to acknowledge, we have DJ Story on the Zoom, and DJ has met with us a couple times and been very helpful, and appreciate his input. Just wanted to acknowledge DJ.
Yeah, and I'm going to rope him in here in a second to this. So yeah, he'll share some information about the stop loss premiums, which I'll get into here in a second. So the projection then for 2025. How I start this is with this number right here, this $3,791,000. That's the expected claims that, based upon the quote we got from Symetra. What I do then is we take that number like we always done, and we assume that we're going to have 115% of expected costs, because that gives us some buffer in case claims are above expected. So that's where we get the $4,360,000 from. We then take 80% of those claims and put it into what we anticipate will be medical claims, and then 20% for RX, and that is how we break out the claims expenses. The estimate for total rebates is set at $243,000. RX pricing guarantee payment based upon average over the last 3 years is $33,000. And we're estimating a stop loss reimbursements, I think conservatively at $100,000. So we're looking at a net claims expense of $3,983,000. If you add back in then the admin from Anthem, the stop loss quote at $502,000, the aggregate loss quote at $33,000, you're looking at total plan expenses of $4,777,000, which is a 13% increase from last year to this year. So that's where that lands. And I think what I'll do at this point is pause and let DJ talk about the quotes. If you can switch to the slide that shows the quote comparison, not that one. Yeah, you just had it up there. That one right there. So if you can zoom in on the middle section, that'll make it easier for DJ to talk about the quote between Symetra and QBE. So DJ, I'll turn it over to you.
And just so everybody, what we're considering is this right here. We'd have to have a motion to approve one of these. So,
right.
And then there's another piece to it as well. Go ahead, DJ.
As long as he's not on mute. Wait a second, DJ. I think we got to fix something on our end so we can hear you.
Can you hear me now?
Yep.
We can hear you now.
Okay. I can't see what's on y'all's.
We have the quote up. I just have the current, the renewal with Symetra, and the renewal with QBE, and that's it.
Okay, perfect. So when we looked at the options, first off, I will say that this is a couple that we have that are the best possible. We actually did quote this to 23 different carriers, along with a captive option that we were exploring to get our best possible option. We had just about 3 quotes come back overall, and that we have our renewal option, and then obviously an option with QBE as well. And I'm trying to talk through hearing myself on feedback. So when you look at these premiums, the biggest difference you'll see right off the bat is the amount of stop loss premium difference of $502,000, I think is what it is, versus 460 with the QBE quote, but I'll point out the highlighted amount of 300,000 on the QBE quote. This is a laser that has been levied against one individual member. That member has a cancer diagnosis where I moved this to our clinical team to review and confirm the validity of this amount. What they have said is that it's nearly guaranteed that member will hit or exceed that threshold. As a reminder on self-funding, we cover the cost of any member on the plan up to that $125,000 spec deductible. What a laser is the underwriter says for that member, because we expect a higher degree of claims, we're going to say you have to take on additional liability, in this case, $300,000. So with this quote with QBE, we're basically guaranteeing that we would spend $175,000 more than our traditional $125,000 spec deductible and hit that $300,000 laser amount. So when we look at a fixed cost difference of 40 grand, I think, well, what's the other pieces that we know that we will pay, or high degree of likelihood we will pay? And that laser comes into effect there. The other benefit that we have with Symetra is that they actually do have a no new laser guarantee in this contract. And so what that means is, and it helped us this year because we had that with renewal last year with Symetra. And that meant that even though there was risk in this member, in this renewal, that they were guaranteed not to laser that individual upon renewal for this year. And they have continued that on for the 26 renewal, meaning that even though we may take an increase in our stop loss premium, they can't laser that individual. And that's important not just because of a $300,000 liability now, but there's no real limits on what that amount could be. For this member in particular, the clinical team, that if everything goes well, this member would be in that $300,000 range. But if additional costs are levied, it could be a $500,000, $600,000 claim or more. And if that were to happen and we did not have a no new laser in place, it would be almost guaranteed that we would have that additional liability upon renewal for next year. So that's the biggest difference between these quotes. There's a slight difference in the aggregate cost premium. Aggregate cost, just aggregate stop loss, as a reminder, is kind of that umbrella coverage. So if we had a lot of individuals that exceeded or reached close to that specific deductible, then we have a cap or a maximum amount of claims that we can pay. And then the maximum claims that Symetra does have is slightly over where QBE is. But again, as a self-funded plan, we're just going to pay the claims we have. So that expected or maximum claims total is kind of just a marker that the underwriters put for expectations for this year. So it's my recommendation that we continue with Symetra because of that lack of a laser on the plan and because of that no new laser guarantee for the next renewal. It puts us in a better spot for not only this year's renewal, but risk mitigation for next year as well.
Okay. And I want to be clear, too, that the stop loss deductible is $125,000. So what that means is that any claim that goes above $125,000, the stop loss insurance policy covers. But like DJ just indicated, the cost for that policy is $500,000. And so the quote with QBE would save us $40,000, but we'd be assuming $175,000 in additional liability probably. So that's why it makes more sense to stay with Symetra, too.
Any questions about what's been presented? And Jeff, you know, your recommendation on this, would you share that?
Yeah, I would. Well, yeah, I agree with DJ. I would stick with Symetra for the stop loss insurance policy. Now, the other issue that I think we've got to take a look at too is, you know, should there be some cost sharing of premiums between the county and employees? To illustrate that, I have two, and I shared this with you by email, but there's two options. One would be an option where premiums would go up by $5, $10, or $15 a pay period, and another option where we'd be looking at $6, $12, or $18 a pay period. I think what's important to note, and I crunched some numbers here. Historically, the county's been paying roughly, or covering roughly 91% of all premiums and healthcare costs with our plan. If we don't pass on any additional cost this year, we're looking at increasing that subsidy to 92.6%. So we'd be increasing that. If we increase the premium by the $5, $10, and $15, then that subsidy would drop back down to 91.4%, which is more in line with what we've done historically. So I think that there's good reason for increasing premiums some. We've only increased premiums once as I've been here, and that was in 2023, and before that it was 2018. So we've been very good about subsidizing the plan pretty heavily.
And I would comment that, Jeff, we work very hard to try to chisel the best option for our employees, because the health care benefit is something that helps retain and recruit employees, and having that, I think we have a very, very competitive plan. And if you look at similar plans across the state, we're really trying to make this a benefit, a true benefit to our employees.
And so that everybody can see this, if you can please switch to the health plan comparison slide.
There you go.
Well, there's one, but I think it's the other one.
That one.
Look. This one that shows just how competitive we are with other employers and the survey data. I mean, you can kind of look across the line there right now. Even the Kentucky State plan, the plan that I could find that was closest to ours, they charge $89 a month, and we're charging $17 a month right now. So a pretty significant difference in premiums. And you can look on down the list, like even at family coverage, just what, if you were on a state plan, it's $716 a month, and right now we charge $258.
So, from feedback from you all over the past, years, it's always been the feeling that, hey, we want to be as competitive as we can to make it a benefit that helps retain and recruit employees. So I'm not saying that we won't ever have to look at an adjustment, and the reality is that that's probably going to happen. But what can we do to try to keep it as affordable as possible? And that, I think that we're doing that. Carving out the pharmacy, and bidding this out like DJ does, all those things help keep us competitive. But, as Jeff mentioned, did you say 13% or 17% over the last year?
Well, we're looking at a 13% increase in total plan expenses. That's the estimate for this year. That's a pretty significant.
But if you look back 2 years, our costs were probably more than that.
Yeah. We're looking at this being a $5 million health insurance plan.
Yeah.
I mean, that's a pretty significant investment.
And, y'all have heard me talk about, we serve our community. That's the most important thing. But we serve our employees by trying to make this as competitive as possible. And, it's very challenging.
The options like 5, 10, 15, or whatever.
Can you put that back up?
Well, the main question was, is that monthly or is that per paycheck?
That's per
Zach,
pay
if you
period.
could put that
Put that-
previous slide back up.
The 5, 10, 15. I think it's option
So,
A. There
so
you
it
go.
goes to 13 per pay period for an employee only, and then employee and spouse, it would go to 78.24, and then 68.74 for employee and children, and employee and family 133.98.
You can kind of see what the current cost per month comparison is too. I try to illustrate it both ways so you can kind of get an idea. But what it does for us is it brings in $60,000 in additional plan revenue. by increasing the premiums.
I'll keep the overall percentage near where.
Yeah.
Where it's a wash.
Otherwise, this will be the first time we've gone above 92% subsidy.
I'll make a comment. Just we've been very fortunate not to raise it in the last several years, but I kind of feel like we should look at raising it some. We were able to give an 8% raise, which was great, and you know, you always hate to come back and take it away on something else, but with our plan going up 13%, my fear is we all know things are going up every year, and in 2 or 3 years we turn around and say now it's going to be $45 a pay period all at one time instead of maybe 5 or 10. So that's my comment.
Yeah,
Small,
I think
right.
incremental adjustments would be good. And I did look. I didn't know what questions you would ask, so I tried to prepare myself as best I could for whatever questions you throw at me. But I did do some calculations, roughly close to the lowest wage earners we have. This increase to the employee paid premium would be 0.4%. So yeah, we gave an 8% increase, and I guess you could argue that we're maybe taking back 0.4%. Yeah.
Rick?
After listening to Kelly and the numbers, the other option would be do nothing. And we absorb that cost.
Right.
But the future is probably what Kelly said. It's going to go up, and then if we have to do something in the future, it'll be big. Or the other option, which I'm not in favor of, is decrease plan benefits, which would lower our costs. I mean, isn't that correct? I'm not an insurance guy.
It's a cost shift. Yeah, either you look, typically when people are trying to save money, but there's really no savings because the expenses are still there, you increase premiums or you weaken the plan design so that there's higher coinsurance, higher co-pays, higher deductibles, and all that is cost shift.
Is this medical, dental, vision, or just medical?
This is just the health plan.
Just health. It's what?
Medical and vision.
Medical and vision. I mean, my family owns a business here. I agree with everybody. It sucks to have to raise health costs, especially, you know, in today's day and time. We have employees that would kill for some of these monthly health insurance. My family, you know, we don't have. It's a tough healthcare market, right? We used to have 13, 14, 15 providers you could go get quotes from. How many quotes did y'all? How many providers? Other than
Well, we're self-insured, so the only insurance we have is the stop loss insurance. I mean, I sent out an article that I drafted, and I'm going to send out again during open enrollment, but just to make sure people understand the nature of self-insurance. I mean, every single claim for any individual below $125,000, we pay.
Yeah.
We in essence are the insurer, unless a claim hits $125,000.
But we still. But
I can comment too on the other carriers. The only other network carrier in our region is United Healthcare. I did a recent evaluation network discounts overall from Anthem, Blue Cross, and United Healthcare. My understanding was that it was about a 5 to 10 point difference on gross medical claims discount. Our net claims are going to be close to $3 million, and we're receiving close to a 60% discount plus. So the idea of changing the network, I think, would be it would be a significant decrease in discounts for Scott County's plan.
Questions for DJ?
Just comment that
Rob Jones.
I'm not for raising it any. Just as an employer, I know how tough it is for the guys to even make it right now, and to be able to pay them what they should be making is even tough. The economy is going to turn, hopefully, with the election. We're hoping it all will turn and come back around. I would hope we could wait one more year before we do try to raise rates. I understand where everybody's coming from and how we should step, but that's just my opinion.
I don't know that insurance in any economy
It's ever going to be. Well,
regardless of who's president or who's not.
but we don't know Joe has said it many times, we don't have a crystal ball. We can't tell what next year is going to hold. So I don't want to base on that, you know. So,
but looking back
historically,
we have gone up in the past 3 years. Jeff, help me.
I can tell you. I mean, I didn't give you the whole sheet because it's just too much information. But in 2021, our total plan expenses were $3.1 million. We're looking at this year it being $4.7 million. And this is real numbers. I mean, from 2021 to 2024, over a 3-year period, total plan expenses went up almost $1.1 million in 3 years.
And Rob, I share your sentiment 100%. That if we try our best to make this a true benefit, and it is. I mean, like Ryan said, a lot of employees would love to, that's not in this plan, would love to have this plan for their self or their family. I just don't want to get in a situation where if we had some high claims and then we had no choice and we're looking at, hey, we're increasing it, $20. I don't want to get and what one option is A, leave it alone and not touch it. But the other option is $5 more a month for single, $10 for employee and spouse more a month.
Per pay period.
Yep. I'm sorry. And then the other is
$15 for family.
$15 per pay period for family coverage. And that's what scares me, just looking back. And, I think when people have and it's never good, but if you have an incremental approach, it's a little easier for folks to budget. That's just my 2 cents.
Well, and I guess what I'd be more concerned about too is, I talked with Rick about this, is weakening the plan design to save money. The risky run then is that if coinsurance gets to too high of a level or the deductibles get to too high a level, what you don't want is for a person to feel like they don't have enough money in savings to go to the doctor, and then they forego care, and then something more critical happens, more severe, like instead of just needing blood pressure medication, now you have a heart attack and need open heart surgery. The impact to that individual, that family, to plan costs is much higher in that environment than it is if you kept a rich plan design. So.
And we've tried to promote the wellness aspect of our program. We've got a biometric screening coming up that's available. All those things we want employees to take advantage of, because if there is an issue, there's never it's always better to address the issue as soon as you know about it on the health side. And that's why we try to incentivize the wellness piece and then those biometric screenings. And what else is there that we've tried to help reduce costs by implementing?
Well, a huge one is the carving out the pharmacy. I mean, that's saving us $250 million a year. That's one of the things I brought to Scott County with coming here. And I think I even indicated in this one note is that if our pharmacy expenses, so here's some very positive news, if our pharmacy expenses were in line with other participants in the pharmacy coalition, our pharmacy spend would be $525,000 more a year than it is right now. I mean, that's huge. So
by carving that out, we're saving significant money on our plan. And when we go to CAECO, people ask about that to me, and I think it's a great thing that we've done. But Rob, back to what you're saying, it's valid, and I understand, and don't discount what you're saying. But at the same time, looking historically what we've done, do we want to have a small increment now and not have to possibly look up in a year or two and have a significant one? That's just my concern. But it's the court, and that's why we vote on things, and that's why we talk about things.
What other questions does anybody have?
Could you put the slide back up with that slide right there? So really, you're considering the Symetra proposal as compared to the QBE And
What do we need today?
it's a two-part,
We're choosing on that.
yeah.
We need to approve the stop loss coverage. So that's one, and whether or not you want to increase employee paid premiums.
And
So, yeah, I'll make a motion for the
Stop loss. Yeah.
so we have a motion.
So with the fees, is it 60,000 is what the,
That's the additional revenue that would be generated by increasing employee paid contributions, yes. And we're looking at plan costs going up, I think it was $560,000. So we'd be passing on $60,000 of that to employees, and the county would be taking on $500,000.
I'll make a second on Wayne's motion
All right.
for the symmetric plan.
There's two symmetric plans. Stop loss.
Well, one is the current. The first one is the current.
So we have
It says renewal, but it's our current.
Yeah, I was gonna say, it says renewal.
Yeah.
Okay.
so we have a motion and we have a second. What other questions are there? Would there be, all those in favor say yea, aye?
Aye.
Any opposed? So we have a Rob Jones with a nay. A nay. Motion carries for Symetra. Now, if no one desires, if the pleasure of the court is to leave the current employee contribution the same, we don't need a motion. But if someone wants to make a motion to consider some adjustment,
oh, I'm sorry, I thought that was part of this.
No.
Yeah.
Oh, I'm good with the symmetric, yeah.
so
Just say yes, please. Yeah, I thought this was in on it, so I'm sorry.
Yes.
Yeah, no, I'm good with this. I thought it was all combined.
so
I misheard that.
let the record reflect that
Yes.
Mr. Jones,
Yes,
make it all in favor.
yeah.
So, back to the other. If anyone wants to, make that motion or the pleasure of the court in regards to that.
So Jeff, if year to date, I know you have to the last 3 or 4 years at least, what would you, if we don't do it this year, what would be the recommendation next year to keep us at that 91%? If you might not probably.
It depends upon what the medical inflation rate is, what the claims experience is. I mean, it's kind of like, once you make your bed,
You really don't have that crystal ball.
Yeah.
No, I mean, you're right.
But it's not gonna go down,
No.
could stay the same, I guess.
I mean, the only place, like last year was an anomaly, 2023. We had $900,000 in stop loss reimbursements. That really helped us. But it's not good because that means your stop loss insurance rates are going to go through the roof. Is because, we paid $400,000 for coverage thereabouts, and we got $900,000 in reimbursements. Well, guess what? We left that and switched to Symetra in 2024 for that reason, because their quote wasn't, competitive.
And I'll just comment too. I would love to say that the claims outlook is that this is going to tail down. Right now, it's hard to see that that's we're moving in a positive direction based on the risk pool and the amount of claims that we have coming in at this point. We don't have the crystal ball, but I'm not going to bet that this is going to shift in the next 12 months.
When you add positions, add employees, there's more cost.
And you said,
One thing that I've talked about with Jeff and DJ and Kelly, Kelly sat in on this meeting, there are employees that could opt to have coverage with a spouse, removing that from our plan. And we've talked about, do you try to incentivize that? Because that's done other places, correct?
Yeah.
So that's a conversation. Y'all follow me what I'm talking about?
It needs to look at.
In my company, if my spouse, now we're on her insurance, but in my company, if I held insurance, if my spouse's company offers insurance, she can't come on my insurance. Like she has to take her own company.
That's a spousal carve out.
Yeah.
Yeah.
So, I mean, that happens, like my company does it. To
And
try
I
to
think
keep
that's
it
common. I mean, I don't think that's an outlier.
No,
And DJ, you've got more experience than us. That's not an outlier, is it?
No, I think it just depends on the philosophy of the group, really. What I see in public employers is that, it's a mixed bag. We have some employers that have very high and expensive family coverage because they just want to provide, from a budget reason, employee coverage. And we have some others that are much more paternalistic and adding additional costs and reduction of costs for family and deductibles and family deductibles. The risk that we have in type of carve outs is we still don't know the crystal ball of who leaves. And if we incentivize folks that are healthy to leave, then our risk pool actually worsens. Versus because we have such a strong and low deductible health plan, if there's any opportunity for the members to stay on this plan, if they have any kind of health conditions, they likely will, because your plan is better than others. Whereas in some companies where you have a higher deductible plan, it's easier to say, okay, we're going to do this carve out. The member has access to a better health plan. They're going to choose that. Scott County is the better health plan in that scenario. So it's not a bad idea, and many people do it. It's just difficult to understand what we would lose and what we would gain.
A lot when it comes to plans. I mean, our plan is very competitive. So I just wanted to throw that out, that's been a topic of discussion, but that comes with cost as well. And I respect 1,000 times what Rob Jones is saying. But at the same time, I don't want to look up and we're staring, hey, we're going up $30-40 a pay period, on folks, and that kind of jump.
So Jeff, you said 0.4% is what this kind of would be like
For the lowest paid.
for the lowest.
If a person earns more, it has
It's a lower percentage impact.
So that's the highest.
That's the highest percentage
Of impact.
Of impact,
Yes.
0.4.
Yes.
Does our health insurance plan have out of pocket at all? Is there any out of pocket to the employee?
Well, if you got deductibles,
You gotta meet your
co-insurance,
deductible.
Your deductible.
and out-of-pocket max, and you got co-pays for prescriptions and co-pays for, doctors' offices and specialists, and yes,
out of
there's out-of-pocket
area,
costs.
in area.
Yeah.
Judge, so the recommendation is 5, 10, and 15 in the Peach area. That's what the recommendation is.
If you went 5, 10, and 15,
Yeah.
the county is absorbing $560,000 of cost. If we added 5, 10, and 15, then we'd pass along $60,320 to our employees, and it would be an increase of that per pay period. And Jeff, the total would go. Can you read the total if we went up 5, 10, and 15? What it would be?
I mean, as far as plan revenue?
No,
The
per employee.
Yeah.
Well, this would be per pay period.
But that's the current cost.
Yeah, that's current, and then this is proposed per pay period. So 13, 78, 24, 68, 74, and 133, 980 per pay period. So there's your $5 difference.
Okay. So
a single employee would go from $8 to $13 per pay period, and so on.
So
and if you want to, here's the cost per month. It's because it's 26 pay periods in a year. It's 1733 versus 4817.
I mean, I don't know how to word this, but I'm going to make a motion that we move in that direction. I guess that would be to adopt the proposed cost per pay period, which is 1378, 24, 68, 74. What Jeff just pointed out.
I think that's a motion.
Yeah, that is a motion,
Yeah.
and I think it's just a preventive measure that we are unfortunately going to have to take. And I agree with Rob. Nobody wants to do this, but it's something that if we don't do now, I think we're going to have to. either pay now or pay later, and we'll pay more later.
That's a motion. Is there a second?
I'll second.
Dwayne Ellison with a second.
Just one more comment.
Questions and comments?
Just one more comment.
Rob
I'm looking
Jones.
at the annual plan revenue per person, and you get down there where it's employee plus family at $390. That's to some families, that's an extra paycheck a year. In
It's
some of our
$290.
employees.
$290.
I thought it said $390. What I said.
That's per year.
Yeah, that's what I'm saying. Per year, that's an extra paycheck for.
No, 257 to 290, so 40.
What I'm seeing is $390 a year.
No, it's
That
He's looking at that number.
yeah,
Oh,
that's the number I'm looking at. I mean, you take somebody that's making $15 an hour, that's an extra paycheck a year for them. That means a lot to some families. And I would rather eat that as a taxpayer at $60,000 than to take it away from our
Is
employees.
390 the increase for a family?
Per year.
That's just my opinion. So.
Now, of course,
That's where
what is important to note too is you're paying this out of your gross pay with pre-tax dollars.
Yeah, I
So the
understand.
impact to your net is a little bit less. It's about 30% less than that number.
I understand.
Yeah.
Thank you. Any other questions or comments?
I'll make one quick comment, and Rob, because I've said in this meeting, we talked about insurance. We were really trying to look at like the lowest impact.
Oh, I don't doubt.
I mean, when you're looking at a $560,000 increase, we may have started with some bigger numbers, and we come back like at least 5, 10, and 15 to try to make it as reasonable as we can, knowing that in the future we're probably going to have to raise this at some point. And I just echo what the judge says and just say, I'd rather do it in incremental parts than.
I understand, but I'm sitting here thinking at the same
No, I
time,
understand.
if I show this to my employees,
Sure.
the first thing's going to come out of their mouth is, when do I get my raise then? That's
Well,
the first
and we
thing's going
gave
to
an
come out of
8%
their mouth.
raise,
And I
which
think we're always going to
helped.
look at raises too.
And I know.
And I will say, I don't think the schools.
It's not a bad increase, don't get me wrong, it's
Well, I
not.
don't think the schools have as good a plan as this sometimes. I mean,
It's a good
big district
plan.
like
It's
us,
cheap and-
It's a pretty good plan. I might need to look at it.
So, Rob, your point is well taken
Yeah,
and,
I appreciate
and
it.
respected.
Yeah, I appreciate it.
And I
understand
certainly
everything.
value it. So we have a motion, we have a second. Any other question or comment? All those in favor, please say aye.
Aye.
Any opposed?
No.
I'm going to be a no, too.
2 noes. Let the record reflect that. Thank you very
David's
much.
still on.
With that said, we'll move on. Road Department purchase request. J.R. Brandenburg, how many salt spreaders do we have mounted as we speak?
Every one of them.
Every one of them.
Yes.
Dogs can bark, the caravan's got to move on, and the snow's going to come.
It is.
So, J.R.,
Let's hope not.
J.R.,
Bring us little.
Is that an AccuWeather report?
yeah. J.R. has 2. J.R., are they tandem dump trucks on order?
Single axle.
Single axle
Yes.
dump trucks. And we have money in the budget this year for those 2. Correct?
Yes, but we won't see them until next budget.
And that's where I was going.
This is where this is coming.
Because we were hopeful that they would come in this budget year, but with supply, like with everything else, fire trucks, ambulances, and everything else, these dump trucks have been pushed probably past July.
I got salt pumpers instead of water pumpers like that.
Salt pumpers. So Chuck Dills had shared with JR and I, and Chuck is the judge in Grant County, about a new purchase that they had made with a 6500, is it a 6500?
Yes.
Diesel, 4-wheel drive, and it's kind of like a utility dump truck, and it has interchangeable beds.
It's basically the frames, truck frame that we use on ambulance boxes and.
And
for
it's
the
a Chevy.
Yes, it's heavy duty, mid-size.
Yes. And, JR just trying to, we had the capital projects plan, and we continue to work through that, and that was part of that two dump truck order. But with this not getting till next year, and looking at this option, would the court consider allowing the road department approving the purchase of one of these that we feel like we could get within a month or so?
Yeah.
It's sitting on a lot at Bachman.
Yes.
And this is state bid contract price.
Well, and I've talked with JR, that's within your budget too, correct?
Absolutely.
Yeah.
And I have 6 frontline snowplow trucks. It is 20 years old plus. And that's the reason when we put this 5-year capital equipment plan and everything together that I wanted to replace 1 dump truck per year, per budget year.
So you don't have 6 going on at
And supply and demand kind of with COVID and everything.
So we've gotten 2
Yes,
that we
got 2.
have, and you had 2 more on order.
Yes.
So, would the court consider an approval of this purchase? And then the other piece is, JR, I think you want to leave the 2 that are on order
for next budget year.
For next budget year.
And that'll put me at the 5 dump trucks that within 6 years?
Yes, sir.
Yes. And this is a very versatile truck. If you look at it, you could put a storage container on it. You can put small dumpsters, 6 to 10 yard dumpsters, numerous different beds. And the salt spreader mounts to the subframe, and you can take that off, and it's got its own legs to store and put the dump bed on within about 10 minutes.
And that bed that you're talking about there has a V notch in the back to take the salt spreader.
Absolutely.
It's like they've done a pretty good job making it a utility type of option with these different beds.
So does this truck come with the salt spreader, or we still have to purchase it?
No, we always have to purchase the box, the spreader.
Yes, it comes with 2 beds, the 1 bed and a salt spreader frame. That's the way this price is, of $100,996.
Then you just have to purchase the spreader later.
Well, he's got additional
plenty.
spreaders.
Don't have to worry about it.
Yeah.
I'll make that motion. We go on and.
So we have a motion.
Second.
We have a second. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Thank you, JR. Sourcewell Musco agreement. This is for the sport courts at Great Crossing Park. And JR's, they're out there working as we speak. And there's been a couple calls this week about coordinating getting the bases for these lights, in and doing it efficiently. But just a reminder that the Sourcewell program is a cooperative purchasing group that we're a member of, and that we purchased lights at Sutton Field a few years ago to do the exact same thing through the Sourcewell. They bid out they do the bidding, pre-bidding, and this is the price. And the tennis pickleball courts, the lighting proposal that I shared with you all from Sourcewell and Musco is $198,500. And this number plus the construction number, we're still, I think, below budget by more than $100,000 for the total estimated budget, what we put in for the whole project. So I'd be happy to answer any questions about this and comments.
Motion for approval, Judge.
Motion from Mr. Wallace. Any other questions or comments?
I do have, let me pull that up. So this bid includes the whole package?
This is $198,500 to install.
But they have a contractor in place to,
Yes.
the way I read it.
Yes.
I read all the details, because it seems like, I was looking for, just to make sure everything's covered.
Yeah.
Because it always seems to creep up these little, wait a minute, we missed this. I mean, it looks like they've covered a lot of things, and I'm not saying I'm not trying to be negative. Just, I always think about rock excavation, because we've installed these kind of pole bases before, and they gotta go deep.
10 feet
Yeah.
with a lot of concrete.
There's still a clause in there that if they hit something,
Well, I can tell them what they're gonna hit.
Right. I tell them that too.
I'm just.
But they get me on that every time too. Like,
Customer, here's a reading. Customer responsibilities. Pay for extra costs associated with foundation excavation in non-standard soils or soils not defined in geotechnical report. Standard soils are defined as soils that can be excavated using standard earth augering equipment. So that's answers your
They
question.
have to hole ram. It's going to cost us more. I mean, it just will.
They hit plenty of rock up on the office.
They're going to. Everywhere you go, you're going to hit.
Right. Well, I mean, they should be aware of that. It should be under bid. So,
But that is in.
gotcha.
That's their standard.
So we had a motion. Is there a second?
I'll second.
Second from Dwayne. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Thank you. New business, I want to bring up to you, Mike Hennigan and I have talked about this. Cam's worked on it. 257 Leesburg Pike. That property went through the emergency management assistance, and it was a flood. I'm trying to think of the acronym. Mike, help me. Flood mitigation.
Severe repetitive loss.
Yes. So we've acquired this property. The FEMA HMA guidance will not allow us to transfer the property interest or sell it. You have to sell it to another nonprofit. There's a lot of stipulations and guidelines, red tape. I think the path of least resistance, we don't want to go out there and mow it and it just sit there. I would like the court to consider allowing for a bid advertisement to lease this for 2 years, conditional upon the approval from the FEMA administrator. And I emailed yesterday with Esther White at UK. We have to submit to her, and she'll run it up the chain to get permission to do it. But we would put in the lease that no buildings can be built. It is strictly for grazing, and they would be required to mow it and keep it in code. Mike, would you add anything to that?
No, that pretty much fits.
So we'd take public bid in a 2-year term, but it's contingent upon approval by the FEMA regional administrator that would allow us to sign off on it.
So how many acres is involved?
5 acres.
So if somebody's gonna graze it, that would include maintaining fencing?
I think we could write that in, Rick. Any fencing would be they couldn't, they could repair, but I think fencing's okay if they wanted to build new fence.
Yeah.
That's not a flood issue. You just can't build a primary structure. You can't, go ahead, Mike.
Can't affect the drainage on the lot. So they said that if you wanted to turn it into a park, you could be approved to put a restroom on it, but that would be about the biggest building that they would accept. It's got to maintain 92% absorbent, be able to just be open rain absorbent area.
And I've had multiple phone calls of asking about the possibility of leasing it.
Okay, that was the next question.
So I've had multiple phone calls. So JR and his crew just recently went out and mowed it, cleaned it all up. But we don't, I think the best route would be a lease that the leasee would be responsible for mowing and upkeep to code and do it for a 2-year term.
We'll eventually, we'll be able to get rid of this, or is this for perpetuity?
This is for perpetuity.
It's unless we can figure out a way to deal with the nonprofit.
If we wanted to transfer it to some nonprofit, but I don't know.
What's a nonprofit going to do with something they can't build anything on? What are they going to do? You know.
Can't put a cemetery on there. I don't think either.
Could a farmer lease it?
Yeah.
No, like they could grow something on it?
We definitely.
Yeah.
Oh, yeah.
Huh? A rice field, as Michelle said?
Rice
No, agriculture, grazing of farm animals,
Parks,
park.
public use.
but we don't need to keep mowing it.
Okay.
I agree. I'll make a motion. on that.
Motion,
Yeah.
second. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes. Moving the ball forward. Next, any other new business from any court member or anyone in the audience? John Ward, Chief John Ward.
Have you sent that email to the magistrate's judge on the request, or?
John, that might have slipped my agenda.
That's what
It's free. It's not costing you money, so
Right.
that's why.
We were recently awarded a training facility grant through the Kentucky Fire Commission for $15,000. Basically, that was going to install a standpipe sprinkler system, training system in our current training tower. So we just start, it's 100% paid for grant by the Fire Commission, wasn't going to cost us anything. But just working through that process, we were getting different sprinkler companies to come out to give us quotes for what we were looking for to do this. The other day, we had a company come in, Landmark Sprinkler, that we were seeking. They were actually the third company that came in. We were seeking a quote for. They came back at us and they said that they worked with Lexington Fire Department in the past, but they are offering to do this free of charge. So we just want, to make sure y'all are aware of it, are okay, didn't see any issues. It's a benefit for the whole county, as far as, being able to train, hook into a sprinkler system, standpipe system. It just further helps us in our training. And we got a company that's wanting to do a community outreach to provide this free of charge.
That's awesome.
Does Landmark do our countywide inspections and whatnot?
I don't know. I'm not sure.
I don't think so.
No.
But the opportunity to maybe roll that money into other training
Right.
is John's investigating that as well.
Right. Based on what you all decide today, then we're going to go back and request from the Fire Commission, can we take that money and use it for another training thing that we could use there to train the department, or its fire department as well.
Motion.
Motion?
Yes, sir.
In a second. Any other questions or comments? All those in favor, please say aye.
Aye.
Any opposed? Motion passes.
Thank you all.
Any other new business? If not, then
Hold on, Judge. The one thing, since Whitney's here, she may want to talk about the Farm City banquet that's on November 26th.
It is November 26th.
Yeah.
So we have Farm City Banquet coming up at the Scott County Extension Office, where we recognize farmers, local businesses for their work in the community. We're awarding 2 farmers, a business person, and a business this year. And it will be November 26th at the Scott County Extension Office at 6 p.m. and still have on November 7th day. So if you want to come, ours will be.
thank you for doing that. And it's awesome. But going back to an email that I sent after a previous meeting about the disaster,
Yes.
did that go into the disaster claims possibility that farmers could make?
Yes.
Did that go in a newsletter?
I sent that out in its own email chain, and I talked to FSA about it and stuff to make sure that producers, that FSA and everything, and producers were all on the same page and stuff, so.
Did you say the 26th?
Yes, the
26th.
26th.
When's our next meeting?
We have the meeting on the 26th at 6.
I know, it's what the committee wants to do every year, and you told me last year that you always do your all's meeting for
Yeah.
Thanksgiving. You guys are more than welcome to do it at the extension office. Come for dinner.
It is the night, and we always have a night meeting. We moved that to Tuesday. If there's any desire or pleasure of the court, that's your all's decision. I'm sorry. We could do a 9 a.m. meeting that day. But we'll, I mean, if y'all, Is there a motion to do that?
We'd have to do it today, wouldn't we?
We'd have to make that
today would be
decision
the day.
today.
Next meeting.
Yeah.
Yeah.
I don't have a problem.
Yeah, normally I don't like to do the 9 o'clock meetings because I always like to have an evening meeting, like, as I've said before, but, you know, this is county business out at the extension office, and I think we should be able to be.
So is that a motion to move the
Yes.
26th to 9 a.m.?
Yes.
Is there a second?
I'll second that.
Second from Kelly Corman. Any other comments, questions? All those in favor, please say aye.
Aye.
Any opposed? Motion passes.
Does that make that a special call?
Yes.
Yeah, you can't,
Yeah.
you can't have new business.
We won't have new business.
wouldn't
anyway.
anyway.
We wouldn't have anyway because we had to change it already because of Thanksgiving. But we're going to be thankful. So,
Well, in that case, y'all are, feel free to come out to the extension office for dinner that night.
so whoever can attend, can Stacy send you an email to confirm that number?
Either Allison or.
All right.
Just so long as we get it.
Thank you. Next item on the agenda is executive session, KRS 61-810-1B. Motion from Ryan Pratt.
Second.
Second from Mr. Jones. Any other comments? All those in favor of going into executive session, please say aye. Aye. Any opposed? Motion passes.
I'll make a motion to come out of executive session.
Motion, second from Mr. Hostetler. All those in favor, please say aye. Aye. Any opposed? Motion passes. Let the record reflect that no action was a result of the executive session. Motion to adjourn, Mr. Jones, second by Kelly Corman. All those in favor? We are adjourned.